So whatever the Supreme Court decides later this month, I think the lesson is absolutely clear. Obamacare is just flat busted. It just doesn't work. And no fix can change that fact. We're not talking about a ding or a dent or a fender bender or a flat tire. The whole law is a lemon. Its very linchpin, its central principle, is government control. That means higher prices, fewer choices, and lower quality. So the answer isn't just to tighten a few screws and everything will be fine. The answer is just to tweak it here and tweak it there and we'll all be okay. The answer is to repeal and replace this law with patient-centered reforms. And the truth is, I don't have to convince this administration that the law is broken. I know that you know that it's broken because you keep trying to fix it. For several years now, HHS has delayed parts of the law, and sometimes, in some cases, they've rewritten it on the fly. We know the most egregious example, the subsidies. The law says that people who buy plans on state exchanges can get subsidies. It doesn't say anything about federal exchanges. And yet, HHS has sent millions of subsidies out the door, putting millions of people at risk. More and more, it seems the administration isn't so much as implementing the law as they're improvising it. We have already seen the evidence of the administration using one account to pay for multiple programs, programs that Congress never funded. That's one of the main reasons that we are holding this hearing today. It is Congress that wields the power of the purse. And more, the administration is acting like a purse snatcher. So again, my kudos to you, Secretary Burwell, on a very difficult assignment. But the American people, they deserve better. They deserve a health care system that puts the patient first. They deserve lower prices. They deserve more choices. They deserve higher quality. And the committee is going to do all it can to make those things happen. And with that, I'd like to yield to the ranking member.
Welcome. You know, I'm glad we're having this hearing, and obviously the Republicans want to focus on ACA, and I think that's a good idea, because what's busted is not ACA, but your attacks on it. Endless attacks. Never coming up with a single comprehensive alternative all these years. So you sit as armchair critics while millions of people have insurance who never had it before. Millions of kids have insurance who would not otherwise have had it. People who have pre-existing conditions no longer are canceled or can't even get insurance. The donut hole is gone. Millions of people in lower income categories are now insured through Medicare, millions and millions and millions. Cost containment is beginning to work. It's beginning to work. The increase in costs, that rate is going down. And so you're livid because it's getting better. That's why you're livid. And I'm not surprised at your fervor. We'll be glad to take it on. We'll be glad to take it on. And I think you just need to understand what this experiment is all about. It was combining increased access to Medicare, to Medicaid, with an increased reliance on the private insurance sector. That's really what this is all about, an experiment. And you talk about government control. More and more people are getting insurance through the private sector. And the states that are denying their citizens further coverage under Medicaid are essentially telling people, well, get lost when it comes to health coverage. Get lost. And you have a governor, Mr. Chairman, who's running around this country talking about the evils of health care when millions of people are benefiting from what happened. So you decided to turn this from budget to ACA. Welcome. Welcome. Your frustration is millions and millions and millions of people are benefiting, have health care when they did not before. So, Madam Secretary, I think they've thrown down the gauntlet. I don't think you I don't feel sorry for you. I think you love this job and you like being the person who's administering this experiment in greater health coverage after 70, 80 years of nothing being done in this town or throughout this country. So I happily welcome you because I think you're a very happy warrior. I yield back.